To our dedicated nurses here at St. Louis University Hospital, I want to extend my deepest appreciation for your dedication and your commitment to patient care over this last year in particular. 2020 was supposed to be the year of the nurse, and oh my gosh, what a year it was. Saying thank you doesn't seem to be enough. As the chief nursing officer, it's the least I can say after the year that you have been through. By the time I arrived at SLU in November, you had already been through many months of what I can only imagine to be the most difficult times of your nursing careers. At a time when most of the country was ordered to stay home, you stepped up and showed up to work to face a virus that we initially knew very little about. In fact, at times, information that was given about COVID would change over the course of the day, based upon what we learned from the CDC. You admirably handled all of the drama and the trauma, facing emotional turmoil and anxiety about not knowing exactly how to care for these patients and how that care might impact your lives at home. You were on the front line for the most dismal part of this global pandemic, helping patients who were at their very worst and taking on the support roles for their families. You were the ones who kept the patients informed, provided reassurance to them, and also communicated with the families to reassure them that you were going to take the best care possible of those patients. You kept them updated because they couldn't be here, but yet they were worried about their family members. You were the ones who, during the patient's final hours, were there to hold up an iPad or maybe even your personal cell phone so that the family could say goodbye to the patient. You were the ones who were at their bedside as the patients may have taken their final breaths. That alone provided incredible reassurance and comfort to our families, knowing that someone who cared was with their family member as they passed into eternity. I am sure there were many nights that you went home and cried, and many days that you weren't sure you really wanted to come back. But you did, and we're grateful for that. As of taking on the extra weight of the pandemic wasn't enough by itself, you also went through several changes. You welcomed a new CMO in the middle of that. You welcomed a new CNO. A few months later, you welcomed a second CNO when I arrived in November. You moved an entire hospital to this brand new state-of-the-art hospital in the middle of a pandemic. You had to learn an entirely new workflow. You had to learn entirely new technology. You had to learn where to find the basic necessities that you needed to do your job. Your units doubled in size and your roles changed because they were forced to. The interventional platform on the first floor, which is pretty unique and not found in a lot of hospitals across the country, required nurses to work in a much different way than they ever had been previously. There must have been many days that your heads were just spinning, but you did an amazing job pulling it all together. We can't lose sight of the work we've had to do in the last 6 months alone, when you worked feverishly to make sure we provide a healthcare environment and patient outcomes that are commensurate with our state-of-the-art building. This is an exceptional building with exceptional people, and the work that we do here every day is exceptional. I have really seen our mission live out. Through our exceptional services, we reveal the healing presence of God. I want to share with you a few examples of how I have seen your hard work pay off in your outcomes. Last year, we had 17 catheter-associated urinary tract infections. This year, we're on target to have just 6. Last year, we had 22 central line infections. This year, we're on target to have just 12. That is because of your commitment to exceptional patient care and minimizing variation in our practice. I have seen our patient satisfaction scores improve from 51.3% to an all-time high, as far as I can see, to 78.7%. We're going to continue to increase those scores because of our approach to care delivery and being patient-centered. Average hold time per patient in the ED has decreased from 14 hours to just 5.5 hours. Our left without being seen time in our ED has decreased from 5.9% to 3.1%. Our surgical volume continues to increase. Our hospital continues to be full. You're working fast and furiously to improve throughput by promoting earlier discharges so that we can accommodate other patients into our ministry from other hospitals or through our ED that need our services. They need our services and they need your nursing expertise. We still have work to do though. We're never going to be satisfied. We're always going to strive to do our very best. We are going to continue to improve on our patient outcomes. We're going to identify our issues through your help, and we're going to master new trends in technology and to become a top leader in healthcare delivery and nursing practice across the country. We're going to continue to raise the bar to achieve the best possible patient outcomes. I am so proud of the work we have been able to do and accomplish in face of unprecedented adversity. And with the ambition and willpower you've displayed, I can only imagine the growth we can accomplish from here. And so I say again to you from the bottom of my heart, thank you for all you have done. And thank you in advance for all of the work that we're going to accomplish. Happy Nurses Week.